We've seen increases in our numbers of beneficiaries in both permanent disability census as well as public assistance beneficiaries. We have exceeded our targets. We have increased our public assistance beneficiaries by 100%. And it speaks to our government's commitment to supporting vulnerable populations across the length and breadth of Guyana. Not only did the individual allotment increase, but also overall our presence in every region and how we delivered in every region, because like the pension, we have now offered persons living with permanent disabilities the option of using the banking system, MMG. We've seen growth in those numbers. And we've also done the direct payments in more communities, increasing to 1,500, where we are going in communities. All the regions have direct payments being done. And we have also increased our shut-in registry. So persons who are bedridden, they have the option of requesting from us the delivery of a permanent disability benefit or a pension, book or payment at home. And those are services that we have been expanding. It brings home to me the fact that our number of social services officers, they're in every region. We have 94 social services officers, and they continue to serve. They go across the mountains, they go down rivers, and they're out there delivering this service. We look at how we are working as a ministry for the improvement of the quality of life of persons living with disabilities. We have done several things. Not only are they receiving the monthly cash grant, the policy introduced by His Excellency, where there is only a one-time application, has revolutionized how people receive their benefits, in that no longer they have to apply twice in a year. They apply once, and that's until they transition to a pensionable age. They also have access to free assistive aids. Every year, we increase the numbers of persons who benefit from things like wheelchairs, walkers, white canes. And it is a very robust program where it just requires a call or request and the ID, and we can provide those assistive aids at no cost. And a lot of that work with assistive aids will come through the difficult circumstances unit, and that unit also helps a lot of our vulnerable populations, not only with assistive aids, things like business grants, funeral expenses, if they're fire victims, a number of things. And $71 million would have been expended this year to capture those persons who are in very difficult circumstances. And in that program also, there is also the iCare program. So these are programs that are really geared towards vulnerable populations across the length and breadth of our country, and people from any region can access these services.